Good morning and welcome back. Well, it's a condition that can prove deadly, often not caught until it's too late. We're talking this morning about pulmonary embolism, or PE, with Gunderson interventional radiologist Dr. Ezana Azene. And Dr. Azene, you call the PE an orphaned disease. What does that mean?
Well, Brittany, Dustin, thanks for having me today. It is an orphan disease, and as the name implies, it means that it's a disease that no specific medical specialty takes care of. When someone comes in with a pulmonary embolism, they may get taken care of by a cardiologist, a pulmonologist, an internist, an interventional radiologist. And what that results in is a lot of disjointed care. The care that you get historically has depended a lot on who sees you first.
So when does this exactly happen, and what exactly happens in the body? Can you explain it a bit?
Well, first let me explain what a pulmonary embolism is. A pulmonary embolism is basically a blood clot to the lungs. They usually start in the legs, where they're called a deep vein thrombosis, or DVT. And when that blood clot breaks free, it passes through the heart into the major arteries of the lungs. And when that happens, the patient gets very short of breath, they get chest pain, and it can stop the heart from pumping blood to the rest of the body and be fatal.
Okay, so this is something that, as you said, is often caught too late by the time it's discovered, and it's kind of that you get passed around depending on who sees you first. So how's Gunderson taking their approach now to treating it?
Well, what Gunderson has done is create something called a pulmonary embolism response team, or PERT. We call it PERT for short. And the PERT is a rapid response team, so that when you come in with symptoms of a PE, your doctor in the emergency room or wherever can contact the PERT, the pulmonary embolism response team, and that PERT team will respond in a coordinated way to take care of that pulmonary embolism and make sure that the patient gets standardized care and follow-up to give them the best chance of surviving.
All right, Dr. Azene, we are running out of time, but we appreciate you taking the time this morning to talk a little bit more about pulmonary embolism and shedding some light on that. Thank you so much.
Thanks for having me.
It's 10 minutes before the top of the hour. We'll be right back with a check of your bus stop forecast. Stay with us.